Good afternoon, everyone, and welcome to today's briefing on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dominic Cardy, ministre de l'Éducation et du Développement de la Petite Enfance. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dominic Cardy, Minister of Education and Early Childhood Development. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous. Good afternoon, everyone. Avec la pandémie de COVID-19 qui perdure depuis plus d'un an, il est clair que nous devons tous nous attendre à imprévus. Au fur et à mesure qu'il subit des mutations et crée des nouveaux variants, le virus peut se manifester n'importe où, n'importe quand. Il peut se propager rapidement, souvent de façon imprévisible. L'éclosion qui sévit présentement dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, montre comment ces infections peuvent se propager. Our public health teams are working tirelessly to trace, test, and self-isolate everyone who may have come into contact with the virus. And I'm so very proud of the work that they are all doing under these very, very trying conditions. From our medical officers to our public health nursing staff, extramural, A&B, the resources from Vitalité and Horizon. It's just been extraordinary, and the collaboration with UNB and our partners in education. It appears from our testing and tracing efforts to date that the cases we have seen in Zone 3 are connected to each other. En raison des déplacements des personnes associées à cette éclosion, des gens pourraient avoir été exposés au virus à l'école intermédiaire George Street et dans de nombreux commerces et établissements communautaires à Fredericton et Nakawik. Une liste d'endroits où il pourrait y avoir eu une exposition au virus se trouve sur le site web du gouvernement. Public Health is now offering COVID-19 testing for all New Brunswickers who have been in public exposure areas, even if they are not currently experiencing any symptoms. Residents may request a test online or call Telecare 811 to get an appointment at the nearest screening center. People experiencing one or more symptoms are also encouraged to get tested, and people with 2 symptoms must self-isolate until their test results come back. And this outbreak really does illustrate what it is that we're up against. The virus has been, again, we're dealing with different variants around the province right now. We have the UK variant in Zone 4, we have the South African variant in Zone 4, and we're dealing with the India variant in Zone 3. This is a virus that can be in your system without symptoms for several days. And so that's why sometimes if we test too early, we won't find it. So the virus can and will spread very quickly through casual contact. We must take every measure we can to slow the spread of this virus. And again, these variants are much, much, much more contagious than any of the strains that we saw before. To counter this outbreak, we have stepped up our testing capacity in Zone 3, and I really do want to thank Horizon and their staff for helping us make that happen. We are doing more testing at our 2 testing locations in Fredericton and have a pop-up clinic now running in Nakawik until Friday. Yesterday alone, we conducted 637 tests in Zone 3. To date, testing has confirmed 10 positive cases linked to the outbreak at McGee House, an apartment-style residence at the University of New Brunswick. Everyone there was tested for a second time yesterday. We also have tested the residents and staff at another UNB residence, Elizabeth Parr Johnson House, with all results they are coming back negative. Residents of both buildings remain in self-isolation. There is also a connection between this outbreak and George Street Middle School, which impacts 900 students, staff, and their families. Public Health has conducted rapid tests on 75 close contacts within that school community. While all have tested negative to date, we have directed these persons to self-isolate for 14 days from their contact point. They will all be retested this Saturday, which will be the 10th day of their isolation. We are also testing all other students and staff at this school, and a subset of these will be tested twice. They and their families have been directed to remain in self-isolation until Sunday. If all these tests are negative, the remaining students and staff will be able to return to school on Monday, May the 3rd. I understand that this is creating a lot of hardships for many families in the Fredericton area, but these measures are necessary to slow the spread of the outbreak. Aujourd'hui, Santé publique confirme qu'il y a 10 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a 2 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Un de ces cas est un contact d'un cas déjà confirmé, alors que l'autre fait toujours l'objet d'une enquête. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a 2 nouveaux cas. Tous les 2 des contacts de cas déjà confirmés. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a aussi 2 nouveaux cas. Ces 2 personnes ont aussi eu des contacts avec des cas confirmés auparavant. Il y a aussi 3 nouveaux cas dans la zone 4, soit la région d'Edmundston et de Grand-Sault, tous des contacts avec des cas déjà confirmés. Il y a aussi un nouveau cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne. Cette infection est directement liée à un voyage à l'extérieur de la province. Et j'ai reçu un appel de l'infirmière de santé publique hier à propos de ce cas et tout va bien au niveau de toutes les précautions ont été suivies. Alors, ça nous rassure beaucoup que les gens suivent les directives de santé publique. Il y a présentement 118 cas actifs de COVID-19 dans la province. De ce nombre, 4 personnes sont hospitalisées après avoir contracté le COVID-19, dont 2 aux soins intensifs. Today, Public Health has confirmed 10 new cases of COVID-19 in New Brunswick. Zone 1, which is Moncton and southeast New Brunswick, there are 2 new cases. One of these is a contact of a previously confirmed case, while the other is under investigation. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 2 new cases, both contacts of existing cases. In Zone 3, which is Fredericton and the St. John River Valley, there are also 2 new cases. Again, these are contacts of previously confirmed cases. In Zone 4, which is the Edmundston Grand Falls area, there are 3 new cases, all connected with existing cases. There is also 1 new case in Zone 6, which is Bathurst and the Acadian Peninsula. In this case is directly related to travel from outside the province. There are now 118 active cases of COVID-19 in the province, and this includes 4 individuals who are in hospital, of whom 2 are under intensive care. Je peux aussi annoncer aujourd'hui que l'éclosion au foyer de soins Saint-Jacques à Edmundston est maintenant terminée. Je remercie notre équipe provinciale de gestion rapide des éclosions et le personnel du foyer de tous les efforts qu'ils ont déployés pour maîtriser cette éclosion. Je suis certaine que toutes les familles de cette province ont été touchées par la pandémie de COVID-19 d'une manière ou d'une autre. But those who are ill and those who are self-isolating to help prevent the spread of this disease need our support. I ask again that you keep them all in your thoughts and prayers and reach out to the ones that you know are self-isolating to see if they need anything, even if it's encouragement or something to make them smile. I am greatly encouraged to see how many New Brunswickers are getting their first dose of the COVID-19 vaccine. Getting vaccinated will help slow the spread of the virus and has been demonstrated to lessen the incidence of severe illness, hospitalization, and death for those who do contract the virus. Je tiens à remercier les pharmaciens du Nouveau-Brunswick qui, en partenariat avec Santé publique, sont passés à l'action de façon à vacciner le plus de citoyens du Nouveau-Brunswick possible. En date de cette semaine, les pharmaciens avaient administré plus de 100 000 doses du vaccin dans l'ensemble de la province et leur appui à notre campagne d'immunisation s'avère inestimable. Many of those first doses were given with the AstraZeneca vaccine, and we also have many people who were given the Pfizer vaccine and Moderna. And the guidance on the use of AstraZeneca has been evolving since it was approved earlier this year. And for those of you who had your first dose with AstraZeneca, and I think Premier Higgs is among those who had an AstraZeneca vaccine, may now be wondering what will happen when it is your turn for a second dose. So New Brunswick protocol to use the AstraZeneca vaccine on those 55 and older, and again, that's because of NACI's recommendations, which is the National Advisory Committee on Immunizations. We have actually exhausted our current stock of this product, and we don't expect to receive another supply until late in the month of May. Le Comité consultatif national de l'immunisation a récemment révisé son évaluation en fonction de nouvelles données et confirme maintenant que le vaccin d'AstraZeneca peut être administré aux personnes de plus de 30 ans. En attente d'un approvisionnement de vaccins, nous passerons ce conseil en revue et déterminerons la meilleure façon d'utiliser ce produit quand viendra le temps d'administrer la deuxième dose. Par ailleurs, pour l'âge de AstraZeneca, l'utilisation est basée sur l'épidémiologie de la province. Et aussi, il y a des recherches qui se sont en train de dérouler dans le Royaume-Uni pour déterminer c'est quoi l'efficacité à échanger une dose pour l'autre au sujet de la sorte de vaccin qu'on utilise. Alors, on attend pour les recherches pour déterminer toutes les prochaines étapes. And so I ask that everyone continue to be patient while we move toward our plan to get a first dose to all New Brunswickers, New Brunswick adults, before the end of June. We are making progress, but the COVID-19 pandemic is definitely not over. So outbreaks are happening each week, as you can see, and we do expect that they will continue to happen. Our best hope in preventing the spread of the virus rests with each of you. And over the past year, we have all learned the skills necessary to limit the spread of infection. But now, more than ever, we must use those skills. We must continue to wear our mask when we're out in public. Nous devons tous continuer à maintenir une distance d'au moins 2 mètres les uns des autres. Nous devons rester à la maison si nous ne sentons pas bien, subir un test de dépistage si nous ressentons des symptômes et se faire vacciner quand vient notre tour. And we have to continue washing our hands and disinfecting surfaces. Still very, very important. But most of all, we must continue to look after ourselves and look after each other. We are truly all in this together. And with hope and determination, we will get through this together. Thank you very much.
Good afternoon, everyone. Bon après-midi. Bienvenue. So this week we've learned about a confirmed case impacting George Street Middle School in Fredericton in Zone 3. As Dr. Russell had mentioned, we know that this is certainly causing anxiety and stress for students, staff, and their families, many of whom have been in isolation since Monday night. And I want to thank everyone for their cooperation and participation in testing as our experts in public health continue to evaluate the situation. And please continue to follow public health directives and get tested. And talking to colleagues from other provinces, our public testing capacity in here in New Brunswick is something we can be proud of, not just in a regional province context, but a global one. There are very few places that have had the success we've had thanks to the expert work that our contact tracers have been doing for now over a year. And this particular situation is presenting us with, of course, challenges around the continuity of learning. I want to reassure all families that district staff are working on contingency plans for every scenario. But at this point, families should prepare for a return to learning, whether at distance or in person, as early as the coming Monday. These decisions will, of course, be influenced by events, so as usual, stay tuned for advice and information and directives from public health. So on Tuesday of this week, we also learned about a possible exposure for a small group of individuals connected to Fredericton High School from a source outside of that school. As a graduate of both George Street and Fredericton High School, obviously these incidents hit close to home for me. So I really want to take the moment to really reassure families that public health is working with that group directly as they're working with the school community in George Street to make sure that self-isolation protocols and other precautions are being taken. And at this point, FHS remains open with no cause for concern. We are quickly approaching now the end of the school year. and I want to acknowledge what an important time this is for our high school students, and it's why I strongly encourage all students who haven't been directly contacted by public health to please continue attending school and follow your regular schedule. Au cours des derniers mois, nous avons acquis beaucoup d'expérience à gérer les cas dans les écoles. Je suis convaincu qu'en ayant votre collaboration et grâce à votre entraide et à votre bonne volonté, nous parviendrons à surmonter ces défis rapidement et de manière sécuritaire. I'd also like to take this opportunity to remind families that if there is a confirmed positive case or possible, I'll say that again to be really clear, a confirmed positive case or possible exposure of COVID-19 in a school or at a childcare facility, families and the school community will be notified directly. So, no news continues to be the best sort of news. So if you don't hear from public health, if you don't hear from the school, you can continue as normal. Je tiens également à remercier tous les personnels des écoles et du district de la zone 4 pour leur travail et leur collaboration au cours des dernières semaines. Nous savons que la situation vous a posé de nombreux défis, mais vous avez continué à vous montrer à la hauteur de chaque occasion et à faire preuve d'ingéniosité, de résilience et de compassion. Je tiens également à rendre hommage à nos incroyables éducateurs de la petite enfance qui, tout au long de la période de fermeture, ont continué à offrir d'excellents soins à nos plus jeunes apprenants. Grâce à vous, nos médecins, infirmières et autres travailleurs de première ligne ont pu continuer à fournir des services indispensables à vos communautés. Merci pour tout ce que vous avez fait pour aider à garder nos élèves, notre personnel et nos familles en bonne santé et en sécurité pendant cette période exigeante. So the department, school, district staff have all been working closely together with public health to keep our schools healthy and safe and open under every circumstance as possible. Because we know that it's incredibly important for the long-term success of our students, as well as for their mental and physical well-being, that students be able to go to class. I'd like to remind parents and students that we do have virtual counseling services available, as well as other wellness and mental health services. And those are available directly through the schools. So with the end of the school year now clearly in sight, I'd like to remind families and our communities that we need their cooperation and support to keep our schools healthy, safe, and open. And there's everything to aim for here. As we get towards the end of the year, I think especially of our graduating class. And certainly my hope is that following protocols described by public health for gatherings and so on, that we will be able to have limited grad ceremonies, limited proms, events that fit in with the mandate from public health. But we can only have that if all of us do our part to wrap our arms around that graduating class of 2021 by following the social distancing measures that public health has described, wearing our masks under all the conditions that are laid out. Follow the rules that we're all familiar with at this point, and we can start to move towards normal. Parce que cet temps que la fin de l'année arrive assez rapidement, il y a des choses qu'on peut faire pour protéger les cérémonies pour les finissants de l'année 2021. Une classe de finissants qui ont vécu une expérience assez exceptionnelle. Et si on prend les mesures définies par Santé publique, on peut avoir les cérémonies pour les finissants. On peut avoir les danses, les autres cérémonies. Mais ça, c'est dépendant sur notre volonté, comme une communauté, comme une province. Alors, j'espère que tout le monde, on va comme citoyens et citoyennes de Nouveau-Brunswick, donner les opportunités pour ces finissants, en suivre les mesures de santé publique qui maintenant sont bien connues. Les précautions, les mesures sécuritaires que nous prenons servent autant à nous protéger nous-mêmes qu'à protéger les autres. Et comme vous le savez, la situation peut évoluer rapidement, chaque jour. On a vu ça en Nouvelle-Écosse la dernière semaine. Nous demandons donc aux familles de continuer d'être vigilantes, de bien se renseigner en surveillant les courriels et leurs téléphones pour toute mise à jour sur la situation. So to fight this virus to the end, to get to the point we can get rid of our masks, abandon social distancing, get back to a normal life, we've got to do the things that none of us want to do. We've got to take precautions. And sometimes they're not easy, and they're irritating, and they feel like they're dragging on as this last winter dragged on. But they work. And as surely as spring follows winter, if we follow these rules, if we follow these precautions, we can put this pandemic behind us. So isolate when you're required. Wear masks when you're supposed to, especially in public spaces. Keep as much social distance as you can for these next few weeks. So over the past year, we've seen how these small steps can add up quickly to a collective response we can all take pride in as New Brunswick continues to be a world leader in fighting back against COVID-19, continues to be a province where we note every case and mourn every death, and where the impact in our province is still felt in human lives that we read and hear about, not in terms of horrifying statistics and numbers reaching into the thousands, as many other Canadian provinces have had to endure. Because everything we do together adds another layer of protection. And of course, that includes getting vaccinated when we're eligible. I never imagined over a year ago that we would see a development of an entirely new class of vaccines, that they'd be developed, produced, approved, shared around the world. And here in New Brunswick today, I can say that over 35% of New Brunswickers have had their first COVID-19 shot. 250,000 doses in our province. This is fantastic news. So as soon as you're eligible, make an appointment and get your shot. Because the faster we can get everyone vaccinated, the faster we're done with the pandemic. Talk to your friends and family if they have concerns, and make that appointment yourself. So, and as always, we work through the vaccine schedule. As a Gen Xer, always have to wait in line for the baby boomers. They're nearly done, and soon it's going to be Gen X's turn. So as soon as your age cohort is rolled into the vaccine approval timeline, make your appointment. So earlier this week, we announced that anyone age 60 plus is eligible to book an appointment at a pharmacy or at one of the dozens of community clinics around the province organized by Vitalité and Horizon. And a shout out to the pharmacists and all the staff in the health networks who've done a superb job. A note for teachers and staff who received their first shot, those at the high schools, that you will get your second shot and that public health will reach out, or your age bracket will become eligible for a second shot, but don't stress about that. Your results are being taken care of, your dates of vaccination are noted, and that will be followed up. And if you contact a local pharmacy and you can't get an appointment, please visit www.gnb.ca/book a vaccine, all one word, BOOKAVACCINE, to find out when the next appointment is available for a clinic in your region. We've added additional capacity onto our phone lines, so if you don't have access to the internet, please call in to 1-833-437-1424 and book your appointment. And remember, if you've had an appointment for a first dose at a pharmacy, but you were able to get vaccinated sooner at a community clinic, contact the pharmacy to cancel the appointment you no longer need so someone else can take advantage of that opportunity. It'll mean that someone else in your community gets the protection of that first shot that much faster. So everyone, please stay safe, please stay healthy, continue to follow Dr. Russell and her team's advice in the coming weeks, and together we can get through this and put COVID-19 behind us. Thank you. Merci.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup, Monsieur le Ministre et Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question and a very quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Silas Brown, Global TV.
Hi, Dr. Russell. I wanted to follow up on McGee House again. I'm curious, and maybe it's just too soon to say, being that everybody is about to be retested, but I'm curious if there's been any apartment-to-apartment spread since we saw them go into a lockdown, I guess.
Hi, Silas. I have the very same question myself, and so that second set of tests is going to give us that information. As of right now, no. After the initial identification of the fact that there was transmission between apartments, since all of the people living in those apartments have been in self-isolation, the only transmission has been within their households. So there's no more apartment-to-apartment transmission at this point in time. But the next set of tests will be very, very telling and will really help us in terms of moving forward and what other steps need to be taken.
Thank you, doctors. Mr. Brown, do you have a follow-up?
Yeah, just quickly, is there any concern about the potential of aerosolized spread in that sort of an environment, or even in the isolation hotels environment, and what's being done to try and counter that?
Another great question, Silas, and again, we're asking ourselves those same questions, and we're trying to get answers to those questions. So one thing that we have done over the course of the last several days is to get more information on the ventilation system and the engineering components around that, and where the airflow is coming from and where it's going. And so if there are any risks, again, we're really delving into that at this point in time and mapping out where exactly the airflow is and where exactly we saw the transmission between apartments. And so, again, between the ventilation versus fomites and surfaces, again, the next set of tests will really help us nail that down.
Thank you. Vicki Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, in other provinces harder hit by new variants, younger people are obviously ending up in ICUs more than ever. So with that in mind, are we considering pivoting our vaccine rollout strategy to perhaps move essential workers and customer-faced hospitality workers to the front of the eligibility list?
Hi, Vicki. Again, I understand that what is happening in other jurisdictions is very, very troubling and concerning. The number of cases, the number of hospitalizations and ICU admissions, quite overwhelming. We're not seeing that situation here, and we are really 4 weeks away from finalizing our rollout of that first dose of vaccine in everybody's arms here in New Brunswick who is eligible and who wants a dose. So we're just in a whole different situation. I'm grateful for the fact that we're in a different situation, but we will continue with our age-based approach. We are getting more doses of Moderna. We're getting more doses of Pfizer. I think we're up to about 43,000 a week coming up in total of doses. So we're in a very, very, again, gratefully so, different position than the other provinces.
Ms. Hogarth, do you have a quick follow-up?
Yes. Are you able to tell us at this point if the outbreak at McGee House is likely the B1617 India variant?
It is the India variant.
Thank you. Danielle Edwards, Canadian Press. Laura Lyle, CTV.
Thank you, Bruce. This question would be for either Dr. Russell or Minister Cardy. We've heard that there are several isolation hotels in the province that have bowed out. I'm wondering if you can confirm that, if that is true, and if it is, if they'll be replaced with other hotels in the region.
Well, I was made aware of that situation, and I am not aware that there will be replacements for those hotels. And JPS has been working very hard to make sure that that process flows as smoothly as possible. But I am aware that it has been challenging, and that's the extent of the knowledge that I have right now on that situation.
Do you have a follow-up, Ms. Lyle?
I do. Dr. Russell, I'd just like to get your assessment of the current situation in Fredericton and just how the cases are unfolding now that we're getting more testing done.
Well, Laura, first of all, I want to echo what Minister Cardy said earlier about how hard everybody's working collaboratively in both the situation at George Street and also UNB campus. Extraordinary collaboration and a willingness to really make sure that we cross the T's and dot the I's and get it as right as possible while we're learning about this new variant. As you know, this is our first outbreak with that particular variant, so again, we're definitely in a position of learning. The testing is going to tell the story. So the fact that people are self-isolating right now, who have all been identified as needing to be self-isolating, is extraordinarily helpful. It's extraordinarily helpful that we have the testing capacity that we do. And as soon as we get the results that we're looking for between now and Sunday, again, that will really paint a picture of where we're at in terms of ongoing risks and next steps.
Thank you, Ms. Lyle. Thank you, Dr. Margot Castader, Radio-Canada.
Oui, bonjour. Ma première question sera pour le ministre Cardy. Vous avez évoqué les cérémonies de graduation. Sous quelles conditions elles pourront avoir lieu, de même que les bals de finissants? Est-ce que les élèves peuvent s'attendre à de telles cérémonies? Si oui, sous quelles conditions?
Merci pour la question. Ça dépend complètement sur les conditions avec le COVID dans la région et dans la province. Et on a les définitions des différentes phases d'ouverture, de confinement, avec les limites sur le montant de gens qui peuvent être ensemble, en dehors ou même dans un immeuble. Et ça va être de décisions sur les balles, sur les cérémonies, va être dépendant sur les conditions avec le COVID. Alors ça, j'espère qu'avec l'appui de la population, on peut avoir les cérémonies comme ça partout dans la province. Mais, encore, c'est dépendant sur nous autres.
Merci, M. le ministre. Mademoiselle Castader, as-tu un suivi aujourd'hui?
Oui, ce sera pour la docteure Russell. Est-ce que, on voit dans d'autres provinces qui commencent déjà à abaisser les catégories d'âge pour la vaccination. Certains, quand même appellent presque la population en général. Ça s'en vient pour quand au Nouveau-Brunswick? Est-ce que vous comptez aller plus vite?
Je n'ai pas compris la question. Pouvez-vous le répéter?
Je vais répéter, s'il vous plaît.
Désolée. Oui, est-ce que vous pensez abaisser plus vite les catégories d'âge pour la vaccination?
La façon que le programme d'immunisation déroule à ce moment-ci, c'est basé sur l'âge, sauf que les gens qui ont des conditions médicales chroniques peut être vaccinés plus vite. Mais d'ici à la fin du mois de mai, on va vraiment avoir la capacité et les doses de vaccins pour administrer une dose pour chacun des gens au Nouveau-Brunswick. Et si les doses arrivent plus vite que ça, ça serait accéléré, absolument.
Merci, Mademoiselle Castader. Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. We're a year into the pandemic and months into vaccine rollout. So why do we keep seeing outbreaks in vulnerable populations such as the grandmas, long-term care home? And what are we doing to make sure long-term care workers get vaccinated now as they've been eligible for weeks?
Hi, Adil. Most long-term care facilities have had all of their residents vaccinated with at least one dose, if not two. Adult residential facilities, nursing homes. There may be some residential type facilities that haven't had all of their vaccines done, and certainly I know there's been a definite boost in healthcare workers in those settings as well in terms of uptake for vaccination. And so in terms of protection, the vaccine is what's going to protect them, and people continuing to follow public health guidance. 2 doses are obviously better than 1, and again, we're hoping to have everybody in the province vaccinated with their second dose between now and September. We know that the risk of transmission is still there, even if you're vaccinated, but what we do know also is that your risk of severe outcomes, hospitalization, ICU admission, and death is lowered significantly. So we will continue to see outbreaks, but we won't expect to see hospitalizations, ICU admissions, and deaths in the volume that we would have seen prior to everybody being vaccinated.
Ms. Ibrahim, do you have a follow-up?
Yes, also for Dr. Russell, thousands of Johnson & Johnson doses are expected to arrive in New Brunswick today or tomorrow. Will this one-dose vaccine be allocated to a specific group for whom a second dose delay would pose a greater risk?
Well, we have a vaccine task force that is working on that planning as we speak, and definitely considering those types of populations that would be better served with Johnson & Johnson, absolutely.
Thank you, Ms. Ibrahim. Savannah
Thank you.
Odd, Telegraph Journal.
Hi there, my question is for Dr. Russell. The latest data from Public Health Agency of Canada has shown New Brunswick is behind every other province in testing per capita. And I mean, you mentioned we did 673 tests yesterday in Fredericton. Is that our full capacity for an outbreak? And if not, why aren't we testing to full capacity?
I'm sorry, I didn't catch your name.
Savannah?
Savannah. Oh, hi, Savannah. Great question. I'm going to try to answer it in a short way, but I can give you a very long, detailed answer around how to actually measure the success of testing. We look at positivity rates first and foremost, in terms of how are we doing? Are we catching all the cases that we need to catch? And obviously testing in a population that you expect to find cases is obviously very good strategy as well. So with respect to our capacity, my understanding is our capacity is around 3,000 per day. We do have capacity at the lab to be able to handle that many tests per day. The comparisons between provinces, again, if you go per capita, you're not really going to get a good sense of what's happening, because the testing has to also be based on what's happening epidemiological in the epidemiological vein with respect to, are there outbreaks, et cetera? Are you testing the right people at the right time for the right reason with the right test? There are many different types of tests now, as you know, between rapid testing, diagnostic testing, screening testing, et cetera. So we stick to diagnostic testing, which is PCR based, and that testing is the gold standard really for symptomatic and asymptomatic people. So as of right now, all of the tests we're doing in these current outbreaks are PCR based and they're diagnostic, and we're putting them through, and Horizon has really helped us with building that capacity in Zone 3 right now. They've expanded their north side clinics, hours and resources, and in terms of staff. Same thing with south side, and then the pop-up center in Nakawik.
Ms. Odd, do you have a follow-up?
I do, thank you, Bruce. I'm also wondering, Ontario has said it will expand COVID vaccine eligibility to all adults by the end of May. We're still on our 60s age group, I guess, in our rollout in New Brunswick. I'm wondering if you can explain, I guess, why we aren't on that same trajectory with our age-based goals for vaccine rollout.
We are the same as every other province with respect to the per capita allocation of all doses of all types of vaccines. So, we do happen to have a population that is older in New Brunswick, so it would take us longer to get to the younger age groups, but we definitely are getting a huge supply, a steady supply in the next month to 3 months, really. So in terms of getting those first doses into everybody who's eligible between now and the end of June, we're on that trajectory for sure. And getting that second dose on board between now and the beginning of September. We definitely have a different population base than other provinces in the country.
Thank you. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour, est-ce que vous m'entendez bien?
Plus fort, John.
OK. Je voulais savoir, on a fait des calculs rapides, puis pour que le Nouveau-Brunswick atteigne son objectif en matière de vaccination d'ici la fin juin, il faudrait vacciner à peu près 44 000 personnes par semaine, mais la vaccination jusqu'à maintenant se fait plus lentement que ça. Vous vaccinez un peu plus de 30 000 personnes par semaine. Est-ce que vous pensez toujours que la cible de la fin juin peut être atteinte?
Absolument. À ce moment-ci, on reçoit environ 30 000 doses par semaine, et dans les prochaines 4 semaines, ça va être augmenté à environ 43 à 45 000 doses par semaine. Alors, c'est absolument qu'est-ce qu'on a besoin pour atteindre notre but. Atteindre notre but.
M. Boudreau, as-tu un suivi?
Oui, juste rapidement, juste clarifier, est-ce que vous avez dit que le nombre de vaccins qui vont dans les bras, le nombre de vaccins administrés va être augmenté à 45 000 bientôt? Est-ce que c'est ça que vous avez dit?
Environ entre 43 000 et 45 000 par semaine.
OK. Puis, si je peux juste faire mon suivi quand même, est-ce que le rythme de la vaccination dépend vraiment juste de l'approvisionnement en vaccins, ou est-ce que ça dépend aussi d'autres facteurs comme peut-être les ressources humaines pour vacciner ou l'hésitation de la population par rapport au vaccin?
Très bonne question. La planification pour cette sorte de déroulement, c'est vraiment depuis des mois et des mois, on savait qu'on recevrait plus de doses dans les prochaines semaines. Alors, c'était ça dans notre plan. Alors, fur et à mesure qu'on reçoit plus de doses, fur et à mesure on peut vacciner plus de personnes. On a les ressources humaines, on a les pharmacies qui travaillent avec nous en partenaire aussi avec les réseaux. Alors, fur et à mesure qu'on reçoit les doses, on les donne. Je crois que ça prend entre le temps qu'on reçoit les vaccins puis on peut les donner, c'est environ une semaine et ça ne va pas changer.
Merci beaucoup, M. Boudreau. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, was there a vaccine shortage in the St. John area earlier this week, and what is the supply there and province-wide as of today?
Well, as you know, we have a per capita allotment from the federal government for all of the vaccines, and that per capita allotment can sometimes change with respect to the delivery times. So any type of distribution issue amongst the provinces and territories is really related to delays in the manufacturer being able to meet the timing commitments for deliveries. So as soon as we get those doses, they are distributed according to the vaccine task force plans. And again, any type of shortage would really be as a result of delays in shipments from the federal government.
Ms. McKinnon, a follow-up?
Well, from the manufacturers to the federal government.
Ms. McKinnon, do you have a follow-up?
So I'm sorry, what was the shortage in the St. John area, and what is the supply province-wide as of today?
There is no shortage in terms of the expectations across the country. We have a per capita allotment, and any delays are based on a delay from the manufacturer to the federal government. If there's a delay from the manufacturer to the federal government, then that delay is translated into each province and territory. So we don't have any shortages per se. We have changes in delivery dates and timings based on those manufacturers. And I haven't heard of a delay in any problem with St. John.
Do you have a follow-up?
Okay.
Do you have one or not?
Yeah, I guess I still don't feel I've gotten an answer to either of those, but what does your latest modeling show for the Fredericton region, and will extra doses of the vaccine be moved there like you did during the outbreak in the Edmonton region?
Yeah, as soon as we had our first cases at McGee House, that conversation happened, and so there will be some diversion of doses to the Fredericton zone. I don't have an exact number, but they did make a decision, the vaccine task force did make a decision that they will divert some to zone 3.
Thank you. Tom Bateman, Brunswick News.
Good afternoon. Dr. Russell, I want to ask about the isolation rules that paramedics are now required to follow after being assigned to an interprovincial patient transfer. The paramedics union president said that the 14-day modified self-isolation that they're now required to abide by isn't reasonable given the fact that they have strict PPE protocols, infection control training, and the fact that they've been transferring patients, including some who are COVID positive, for the last year. Can you just tell me why paramedics were included in these requirements in the first place, and if there's any flexibility to modify that rule to reflect those concerns?
Hi, Tom. So my understanding is it's work isolation that they have to do, and my understanding is that's based on the variants. The variants obviously are more transmissible these days, and we're still learning about that, so it's really a protective mechanism to make sure that we are doing everything we can to make sure that people are protected.
Mr. Bateman, a follow-up?
Yes, please. Doctor, are you aware of any paramedics who've become infected with COVID-19 while working in New Brunswick?
No, not that I'm aware.
Thank you.
But, you know, I think the other thing we do have to continue to make sure that the public is aware of is, as I've said earlier in the press conference, we are dealing purely with variants of concern and variants of interest now. This is very different than outbreaks prior to Christmas. Even the first outbreak in Zone 4 in January, that was not a variant of concern. So everything since really early February, March have been outbreaks related to variants. So everything that we're doing right now has to be adjusted to take into account the risks that these variants have posed with more aggressive transmission, more aggressive and serious symptoms that require hospitalization, ICU admission in younger populations. So right now we've had 13 public exposures, some having multiple exposures. We've had exposures in Grand Falls, Edmundston, Fredericton, Nakawik, and we really want to emphasize the fact that with these new variants, because they're more aggressive and more contagious, all the things that we have been doing, we have to continue to do, and even perhaps do more of. So do more hand washing, do more disinfecting, make sure you always wear your mask, make sure you're always physically distanced, make sure you keep your number of close contacts really low. We do have a good month to, 4 to 8 weeks before we get the population vaccinated with the amount of protection that we really want. And again, just today alone, 13 exposures, public exposures. So we really, really want to make sure that we're protecting our population from these variants of concern and variants of interest.
Thank you.
Thank you.
Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you.